Let's deviate a little bit from the agenda here, and I'll ask you if you would, let's open in a word of prayer. If you would, please bow your head with me. Dear gracious Heavenly Father, we thank you for this precious gift of life you've given us, and this beautiful day in particular. We ask you to help us to use the balance of it to do your will and glorify you, dear Lord. The waning days of this session, dear Lord, we ask that you be with us and give us patience and wisdom and guidance in all that we do. Make sure that we always do it in the glory of your name, dear Lord. And always help us to remember to love one another. I ask these things in your name. Amen. Becky, please call the roll.
Senator Rocky Adams, Senator Chambers Armstrong, Senator Berg, Senator Carroll,
Here.
Senator Elkins,
Present.
Senator Funky Fromeyer, Senator Nemes,
Present.
Senator Tishner, Senator Wise, Vice Chair Douglas,
Present.
Chairman Meredith.
Present. Again, we are duly constituted to do business. Slight deviation in the agenda. Once again, I want to go to the regulations review first, because I'm afraid that we could possibly lose our quorum sometime during the course of this meeting. So with that, the first item is on 900 KAR 50020. You remember the last meeting we had? I think it was the last meeting or the one before. 2 meetings ago. We kind of challenged the cabinet on their amendment to the state health plan regarding ambulatory surgery centers. I'm very pleased to announce that they have withdrawn that and give us another amendment. So to that end, I hope you've had a chance to see that. I entertain a motion to accept the agency amendment. Motion by Senator Carroll. Second by Senator Douglas. All those in favor will say aye. Any opposition is by like sign. Is that voice? That is a voice vote. All those in favor say aye. Aye. Any opposition? Right. Thank you. Now that that regulation has been amended, we have to entertain a motion to remove our committee's previous deficiency. So is there a motion to that effect?
Motion.
Motion. Is there a second? Second. Again, all those in favor say aye.
Aye.
Any opposition by like sign? Nope, that was... All right. My apologies in my haste to get everyone out of here. I'm getting a little bit ahead of myself. These folks do a great job of structuring this for us. This has to be a roll call vote. Again, this is the motion to remove the previous deficiency. Please call the roll.
Senator Rocky Adams, Senator Chambers Armstrong, Senator Berg, Senator Carroll, Senator Douglas,
Aye.
Senator Elkins,
Aye.
Senator Funky Fromeyer, Senator Nemes, Senator Tishner, Senator Wise, Chairman Meredith.
Aye. Roll call shows 8 members voting aye and no members voting no. Motion to remove the committee's finding of deficiency has passed. Thank you. Moving on to our agenda. It's originally structured. First bill we're going to hear today is Senate Bill 295. Senator Tishner, if you would, please proceed to the table. If you would, please introduce yourself for the record.
Senator Lindsay Titchener, District 6.
Is that on? I couldn't hear you. I'm just getting old.
Can you hear me?
I can hear you now.
Okay.
Yeah. All right.
Do you want me to introduce myself again?
Yeah, just humor an old guy. Yeah.
I am Senator Lindsay Titchener, District 6.
Excellent job. You do have a substitute?
Yes.
Correct?
Yes.
Is there a motion to approve the committee? Motion, second?
Second.
Second, all in favor say aye. Aye. All right. Then Senate Bill 295 is amended by PSS 1. Do we act on that now? Or excuse me. Senate Bill 295 is amended by PSS 1. Is there a motion to accept that, approve that? Motion approved.
Second.
Second. This is a voice vote, so all those in favor vote aye. Any opposition, by like sign. All right, thank you. Please proceed.
Thank you, Mr. Chairman. Senate Bill 295 is a one-paragraph bill that was a one-sentence bill that will prohibit the COVID-19 vaccine from being required for student enrollment in activities for employment as defined under KRS 34430, compliant with federal definition of employer according to the Civil Rights Act and the American Disabilities Act. And it will not be able to be required for maintaining or acquiring professional license and for receiving medical treatment. And you can read the bill very clearly. It's just one paragraph. Since the introduction of the mass vaccination mandates of the COVID-19 vaccine under emergency use authorization in response to SARS-CoV-2, the world has seen an unprecedented rise in sudden cardiac events, miscarriages and stillbirths, blood clots, myocarditis in youth, and sudden deaths among all ages, most notably among those not susceptible to the virus. The deaths and adverse events reported to the Vaccine Adverse Events Reporting System that are attributed to this vaccine total more than all other vaccines combined since the CDC implemented the reporting system in 1990. Warning labels on the CDC's vaccine information statement regarding the COVID-19 vaccine give a strong warning for males aged 12 to 39.
Motion on the bill.
Motion, is there a second? Motion is second. Any questions? Call the roll.
Senator Rocky Adams. Senator Chambers Armstrong.
No.
Senator Berg.
No.
Senator Carroll.
Aye.
Senator Douglas.
Explain my vote.
Please.
I vote aye, and I want to thank you, Senator Tishner. This is a place where most people would never go. They don't want to take the heat. They understand things are right, but they don't want to take the comments that come with it. I want to congratulate you for doing that. I want to congratulate you for this bill.
Senator Elkins.
Aye.
Senator Funky Fromeyer. Senator Nemes.
Aye.
Senator Tishner. Senator Wise. Chairman Meredith.
Aye. 8 to 2. The vote is 8 to 2. Senate Bill 295 is amended by PSS 1. Passes with favorable expression. So congratulations, Senator. Next item is Senate Concurrent Resolution 187, and this is my bill, and I'm going to do this from up here. I hope it can be a short discussion. Had a lot of discussions during the interim, during this session as well with you folks, obviously, with leadership. And there's so many factors that are affecting healthcare in Kentucky that it seems we play the game of whack-a-mole and trying to address those deficiencies. And there's got to be a much better way to do it. And you know, we've heard discussions about payments or lack of payments, Medicaid issues, certificate need issues, and the list goes on and on. And what I would hope to do with this task force is let's sit down and try to put everything on the paper, so to speak, as to what's impacting healthcare in Kentucky. You know, we have not moved the needle on improving the health of our population, and we need to come up with a plan, a true plan, to try to move the needle on this. So that's what this. Motion on the bill. Thank you.
Second.
Any questions? Any discussions? If not, Becky, please call the roll.
Senator Rocky Adams. Senator Chambers Armstrong. Senator Berg.
Explain my no vote. Honestly, I am not convinced that the members of this body have the experience and understanding of healthcare to actually make these decisions realistically and in the best purposes for the state. So I'm going to vote no on this. Thank you.
Senator Carroll.
Aye.
Senator Douglas.
Aye, but explain my vote.
Yes, please.
Thank you, Mr. Chair. This is the resolution for a task force, which means asking experts to come in. Experts are those people who have a better grasp on the information than others. We're not expected to think as people in the healthcare space do. We are, well, most of us are not experts in the healthcare area. And I want to thank you, Mr. Chairman, for bringing this resolution. This is something that we've needed for a long, long time.
Senator Elkins. Senator Funky Fromeyer.
Explain my yes vote.
Yes, please.
I'm desperately concerned about our continued deliberate efforts to not be very clear about how money is spent in the state of Kentucky. High dollars on Medicaid, high dollars on Medicare, high dollars in so many aspects, but we really don't know what's the cost of health care in Kentucky. I desperately hope that this resolution will dig into that because that is part of the disparity. Thank you.
Senator Nemes. Senator Tishner. Senator Wise. Chairman Meredith.
Aye. Second concurrent resolution 187 pass with favorable expression with a vote of 9-1. Thank you for your vote on that. I appreciate it. Next bill is House Bill 166. Representative Jason Nemes. And I know Jason Nemes, and this is not Jason Nemes. Maybe,
Chair, I want to thank you for that compliment.
His father. DNA test here or something. But please
Thank you.
identify yourself.
Obviously, I'm representing Representative Nemes on this bill. House Bill 166. This is Steve Riley, State Representative, 23rd District.
Karen Lentz, Legislative Agent for the Epilepsy Foundation of Kentuckiana.
First of all, Mr. Chairman, I'd like to say that the House Bill 166 passed the House unanimously and is supported by the Epilepsy Foundation, the Kentucky Coroners Association, and the Kentucky Medical Association. This bill refers to...
Motion on the bill. Is there a second? Second. Second by Senator Carroll. All those in favor of the motion vote aye. All opposed vote no. Please call the roll.
Senator Rocky Adams. Senator Chambers Armstrong. Senator Berg. Senator Carroll.
Aye.
Senator Douglas.
Aye.
Senator Elkins. Senator Funky Fromeyer. Senator Nemes.
Aye.
Senator Tishner. Senator Wise. Chairman Meredith.
Aye. House Bill 166 passes with favorable expression with a vote of 10-0. Is there a motion for consent? There's a motion and a second for consent. All those in favor vote aye. Aye. Any opposition by like sign? Bill is on consent. Congratulations.
Thank you very much.
I appreciate you me not taking up too much of your time. Thank you very much.
I'm sure Representative Nemes will be very jealous that you were able to accomplish this in such a short period of time. Thank you. Next bill is House Bill 174, an act relating to patient medical records. Sponsor is Representative Rebecca Raymer, who is running to the table. She either wants to get this passed or wants to watch a UK ball game or all the above. Please introduce yourself for the record and proceed.
Representative Rebecca Raymer, District 15. And I do have a committee sub,
Yes,
and
you
I'll
do.
just briefly explain the sub. And it was just because of a matter of time. The committee sub attaches House Bill 645 to 174, and that is a bill concerning the medical orders for scope of treatment. This is a form that's used when a patient is making end-of-life decisions. It just makes the form less wordy, a little easier for families and patient representatives to understand. It was a collaborative effort. All the stakeholders are in agreement. It's just making the form easier for everybody.
Motion to accept the sub. Is there a second? Second. All those in favor say aye. Any opposition? There being none, it passes. Please proceed.
Okay, so House Bill 174 is a bill concerning medical records for minors. So I had some constituents that came to me because when their child turned the age of 13, they lost access to their medical records until the 13-year-old physically came into the medical practice and signed a consent granting the parent access to the records. After looking into it, it was something that had actually happened in other areas of the state. I had some other state reps that reached out that the same thing had happened in their area. So House Bill 174 just simply says that a parent
of a minor or the representative or guardian of the minor maintains access to the health records unless protected by any other state or federal law like HIPAA. And I'll just go ahead and say up front, there are instances where there may be certain circumstances where a minor's records would need to be protected. Abuse, neglect, if a provider suspected that, they have the discretion to not disclose those records. And I'm happy to answer any questions.
Senator Berg, we do have questions, and we do have folks. We do have questions, and we do have folks who want to speak on this bill. In addition to the bill sponsors, so I'll entertain the questions first. Senator Berg.
Thank you, and thank you for this bill. First, okay. If you have a 16 or 17-year-old woman who has been sexually abused by her father and is seeking treatment either for her mental health or physically, what will this bill do to her ability to keep her medical records private from her abuser?
I'm not a lawyer, but my understanding would be, I'm assuming you're saying protect it from the person who was the perpetrator. And I would think that the provider would see that as a risk of abuse or neglect, disclosing those records to the person she's saying committed those crimes. So I believe they're protected.
A follow-up question, please.
Yes, please.
The provider, the medical provider, is the one that you're going to say, tell us the family they don't have access to the medical records after we just passed a bill that said they do?
My bill says unless protected by any other state or federal law. And that HIPAA grants providers the discretion.
Not at 13. HIPAA only covers 18 and up. Parents have the right to make medical decisions for their own children with certain very limited exceptions.
HIPAA speaks to the records of minors.
Senators, we can't hear you. Is your mic on? Or?
HIPAA is the Health Information Protection and Portability Act. It has to do with who can share medical records with other providers and with billers. It does not cover parents and their minor children. That is not covered under HIPAA.
The HIPAA privacy rule speaks.
Questions? If not, again, a couple of people have signed up to testify, I believe, in opposition to this bill. So if you would step away from the table, I'll introduce first Tamara Weeder. Ms. Weeder. Welcome to our committee. If you would, please make sure your mic is on and identify yourself for the record, and feel free to proceed.
Thank you for allowing me to testify. My name is Tamara Weeder. I'm the Kentucky State Director for Planned Parenthood Alliance Advocates. I'd like to clear up just some confusion. So HIPAA defers to state laws on minors. So Kentucky does have carve-outs for certain services like reproductive health and mental health services, and there is a statute already that carves that out. But HIPAA, the state laws do defer to Kentucky State around that, and that is nationally around minors' consent laws with their records. And I think it's really important because if with House Bill 174, this does run afoul of Title 10 as well and the privacy there. And I think it's really important when we're talking about this, and I really want to relate this. Me, when I was 16, I was having a lot of pelvic pain, so much so I didn't know what was going on. My mom took me to my pediatrician, and we started talking about periods, and he could tell I was just so uncomfortable. And he asked my mom to step out of the room. Then he started asking me questions. He asked me if I was sexually active. He wanted to ascertain whether I had an STI. He wanted to figure out what was going on. But one of the things he told me before all of this was, you are protected in this space. My mom did not abuse me. My mom was not going to kick me out of the house, but he wanted to create a level of trust so that I would tell him what was going on so that he could treat me. That was so important. Now, what had happened, I found this out years later because endometriosis takes sometimes 7 to 10 years to diagnose. But that's what was going on. But I was uncomfortable to talk about my period with my mother in front of the doctor. I'm not uncomfortable now. I work for Planned Parenthood. It's part of my story. But this is a common narrative. Kids are uncomfortable to have these conversations. And now, with a bill like this passes, we're going to have to disclose to minors under the age of 18 that all of your medical records, upon request of your parents, mental health, reproductive health, are going to be turned over to your parents. This is going to create a chilling precedent because I was not sexually active, but what if it was an STI? Am I going to tell my pediatrician what was going on if my mom's going to find out and I'm going to get yelled at? Maybe not, maybe. But this is going to have a chilling consequence for medical care and therapeutic care across the Commonwealth. And I think we really need to think about the unintended consequences and work to make sure that parents can have access to records in, with Representative Raymer's situation, but protect the carve out. And please, one thing we're asking is to protect the KRS statute that we do not believe, and we have worked with other partners across this who do not believe the carve out is protected. Thank you.
Thank you. We do have a question, Senator Funky Frohlmeyer.
Yes.
I appreciate you bring those concerns, and I'm reflecting my now 28-year-old son on the conversation that about 12, 13-year-old with a pediatrician. But is it possible that we're actually not making the space for a parent to be a parent, to actually be able to be in the presence with the doctor, asking those very important questions, but with the parent standing by? Because I'm a bit afraid that we're promoting the inability for parents to be parents and creating a safe space that doesn't, because you're not going to be there when the child gets home. So who's actually going to then try to understand, thinking about your mom for a minute, what issues are we really dealing with? So
Sure.
I'm wondering if we're not seeing some significant consequences already to not allowing parents that space to participate in the medical conversation with their loved child.
No, and I don't think that the parent should be removed fully from those conversations. And quite frankly, my provider did create an opportunity to learn how to talk about my body and talk to my mother about it. My mom's a nurse. I grew up in a household where I didn't have fear, but also I needed to be able to talk to my provider and know that if I was uncomfortable talking to my mom, we were all teenagers, let's be honest. There were things that we wanted to talk to our providers alone. And I think that we can empower our children. We want them all to be safe and have trusted providers, healthcare providers. We should be empowering our doctors to know that they can create safe spaces for our doctors. And I think our students, our children, our children, because that's a really important component to creating a safe and healthy lifestyle for everybody as they grow up. And I think parents have a role to play in that. And sometimes that is creating that avenue that they know that they can talk to a doctor, and hopefully they have that conversation with you after and empower them. I know I talked to my mom afterwards as well. Some don't have that. Some are not also in that opportunity to do that.
Senator Chambers Armstrong, you have a question, comment?
I do. Thank you, Mr. Chair. So I think I heard you say that basically the state of the law right now in Kentucky is that minors have confidentiality when it comes to mental health treatment, reproductive health care. I believe there's also an exception if the provider thinks disclosing it to a parent would cause the child harm. Is your reading of this bill that then all of that is wiped out? I think what I'm getting at is really Senator Berg's question. Are there exceptions for a child that is being abused, for a child that there might be some significant risk if this information was given to a parent? What sort of protections do you see in this legislation?
We believe that that is covered. And one of the other components I think that is covered is that is not covered is drug abatement. So if a child does go to seek drug abatement, and that we're thinking 16, 17.
I'm sorry. I think so. You said you believe it is covered,
It's
or you
not.
believe it's not covered.
Not
So
covered.
if a child was being abused, there's nothing to protect a parent from accessing those records.
No, I said I believe that it is.
It is covered. Okay.
Yeah.
Thanks.
Senator Nemus.
Yes, I think your interaction with Senator Funky Fromeyer kind of. Yes, I think that kind of answered my question. But with your instance with your mother and your mother and doctor, they kind of agreed to let you have access to the doctor so you'd feel comfortable. But after that conversation, I feel, and don't you feel, that your mother should know your record so she could make a informed decision on your care? What would have happened if she could not see the record and the doctor wouldn't let her see it? What kind of care would you get? Who would decide that?
My doctor would support me through my care. I think that's really
so you
important.
would give the doctor the responsibility of your care over and above your parents.
My mother is not a doctor.
I understand that, but I do think that the parent has the right, with the doctor's knowledge and experience, to make the decision for their children.
I think, with all due respect, I think that, yes, my mother is a supportive parent. Yes, she wants to make sure that I have the best opportunities afforded to me, and especially with my health and well-being. And she trusted me by taking me to the provider. She trusted the provider and gave me that opportunity to have that space. And I think that we all, as parents and community members, when you're choosing a doctor, you are choosing somebody that you trust. You are choosing somebody as well that you are putting your trust in with your kids. And also, I think you have to start to trust your children to be advocates for themselves as well.
Mr. Chairman, may I?
Yes, follow up.
Yes, but it's up to the parent to decide on the doctor, and not every doctor. I don't think it's a responsibility or the doctor's obligation to be able to decide for a child over and above a parent, unless there's something that the parent should be ousted by law with abuse or whatever, and if the doctor sees that, to report that. Otherwise, I think that the parent's right and obligation to decide for their children, not a doctor or anyone outside. But I thank you for your testimony.
I thank you as well. I don't see any other questions, but we did have someone else to speak on this bill, and that's Ms. Kara Stewart. If you would, please come forward.
I don't think I've... Hi, I'm Kara Stewart with Kentucky Voices for Health, and I've definitely never testified about a bill without having met with the sponsor before. And usually I've met with all of you lots of times by the time that I'm going to testify about something. But I didn't think this bill was moving, and I was pretty surprised to see it. And I didn't think it was moving in part because... it's in conflict with the bill you just passed a couple years ago. So a few sessions ago, you all passed a bill that is now law that expressly gives teenagers the privacy that we've heard about just a little bit. And now this puts providers, I'm mostly here, I'm sure you all know, KVH, we work on healthcare access and removing barriers. So I'm mostly here about our healthcare workforce. This is another attack on our healthcare workforce. We are already facing massive shortages and all kinds of healthcare providers, and this throws our providers into weird legal limbo because this law is in conflict with Title 10. This law is in conflict with our existing statute and KRS 2.214 dot something. Sorry. And when that happens, providers get chilled. When that happens, providers say, I throw up my hands. I call uncle. I can't figure it out. So that's why I'm here to say that I want to protect our healthcare workers. I want to protect access to healthcare for everyone. And I do think that we're putting providers a lot of weird pressure on doctors to make decisions about whether or not somebody's in a position where that's safe or healthy for their parents. Doctors can't know all that. What we can know is that we can trust that. So, and I've also been the reverse of the Tamari scenario. I have a 14-year-old. I had the thing happen that that Representative Raymer was talking about, where all of a sudden my chart flipped and I couldn't schedule an appointment for my son. And I was like, "What are you talking about, St. Elizabeth? He can't make his own appointments. Like he can't I have to remind him to put on deodorant. He can't schedule his own healthcare appointments. So, and they said to me, oh, look at this law. And I said, oh, okay, well, let me figure out this law. Where did this come from? And I think that they were interpreting it incorrectly. And then they did, sure enough, switch it back so that I could schedule his appointments, because all the law really did was just the mental health, substance use, and reproductive stuff. So, and I pushed back on them and said, hey, I don't think this law prevents me from being able to schedule appointments from a 13, now he's 14. And so they granted me access back through my chart. And they said, well, we don't have a way through my chart to restrict it to just these kinds of appointments. So that's why we just automatically do it for everybody. So I think that there's been a little bit of an overreach based on the existing law by some of the providers out of laziness. Or I don't know. I shouldn't imply intent. I don't know. But they told me they didn't know how to easily make my chart work one way or the other. But I think the law you all passed a few years ago was good. And it puts teenagers in the right spot to be able to, and my son walked in and said, yeah, well, I don't want to have to be responsible for my healthcare stuff. But oh my God, if he did use tobacco, I bet he wouldn't want to tell me. And if he wanted to quit, I bet he would want to be able to find a way to get that help. So, and I would trust for that. So, to protect our healthcare workforce, and to respect the work you have already done and not have a bunch of conflict of laws and a whole bunch of lawsuits and setting our providers up to have extra lawsuits going in two different directions, I would ask you to oppose this bill.
Well, I appreciate your testimony, but one thing that concerns me is words matter. And when folks say attack, that has a very strong connotation to me. And I think it's a little bit insulting to this body and the people who prepare these bills. I don't know if anybody wants to attack anybody here. We're trying to do what we think is the best interest of our constituents. And I appreciate you've got a lot of passion about this, but we just need to be careful with our words. It's a tough world that we're living in right now, and if we're not going to treat each other with respect and a little bit of kindness, I'm not sure what the next bill is going to be, because it's not going the right trajectory. But I just caution you that, particularly for this committee, let's not be inflammatory. Senator Funky Frohmeyer, you have a question?
I do, and I do thank you. I know that you have a voice with a lot of care and compassion. But when I hear the example with Planned Parenthood presenting, and I hear the example of tobacco, it's tying right back to what Senator Nemes acknowledged. If I've brought my 13-year-old to a medical professional, the medical professional is going to advise. They're going to diagnose. They're going to counsel. But ultimately, it's the parent's responsibility to take action. I am a mom of 6 kids. My youngest is 14. And I get that there's a lot of brain development that's happening. So if a 13, 14, 15-year-old is talking about tobacco, sex, pregnancy, the parents need to be present.
I think in most scenarios they can and would be. I think the rare scenarios where a child doesn't want their parent present, I think there's good reason.
Well, just to be clear, the example was given.
Yeah.
Mom is a nurse, and I feel awkward about my period. And I was also 14. My mom was also a nurse.
My mom's also a nurse. We can have a club.
So what your testimony is, and you used the example of tobacco, how will this bill prevent a parent from actually parenting their child and being able to help take action if the doctor makes a diagnosis, and you just said you have to recommend that your child put on their deodorant unless you actually do it for them. So it's still going to require a parent to pick up the prescription or whatever
for
as
sure.
part of the diagnosis.
And I would
so
say
I'm struggling with how this bill is going to harm the child versus continue to really strengthen the bond of a parent and a child that tries to get their child to adulthood and successful independence.
I live that every day. So, I mean, I absolutely, literally, and that's all of our goals, right? To get our kids to be successful, independent adults. And I would say that almost all the time, that's exactly what it's going to be, right? Like this doesn't the existing law does not prevent me from being in that room, does not prevent me from having access to those conversations and participating and seeing my child's records. Right. Well, for those specific areas, not for all like general care. It does for those specific areas where teenagers are currently allowed to consent to their own care. Because there's also two issues here. There's the consent to care and the accessing medical records. Our current law allows teenagers to consent to their care for specific areas. We had, during the committee hearing, there was unhoused teenagers who didn't have parents that came in and testified about how they'd been prevented getting the antidepressants that they needed because of our laws, and that was part of why we passed the bill that is now in law, that says they can consent to care for these areas. So it was a very thoughtful process when the law that existed was passed just a couple of years ago. And I think there was a lot of testimony for that. A lot. Like a lot of people lined up waiting to speak. That's not true here. And I wish that it were, because I think there could be some of those same experiences to explain how common, how rare. We do want parents to be involved, and I think parents still can be involved. I think putting this in conflict
You're starting to be a little bit redundant now. We need to kind of move on this, and let's not debate this. That's not the purpose of being here today. It's to question, get information. So let's move away from that. Senator Tishner, do you have a question, comment? Thank you. Senator Berg.
I do have a question. I don't know, honestly, that you're going to be able to answer this for me, but in my practice of diagnostic radiology, we got a 14-year-old sent in for an upper GI, which would be contraindicated if that patient were pregnant because of the radiation associated with the fluoroscopy exam. You don't put pregnant women in fluoroscopy exams for upper GIs. If mom were in the room and I said to this patient, is there any chance you're pregnant? That child will almost always lie to me in front of their parents. I cannot trust that answer. So I either have to be able to ask that child outside of earshot of the parent, or I have to order a beta HCG, a blood exam that costs about $120, I think, on each and every teenager that comes in for this exam. Is that your take on what this bill is going to do to me?
That is outside of my pay grade.
All right.
I would say, I don't know that. I would ask the bill sponsor.
I would say no.
You would say that I can ask this 13-year-old child in front of their parent, is there any chance you're pregnant? They say no, and I can go on with my work as if they answered me truthfully?
My bill only deals with access to medical records once care has been provided.
Okay. The medical record will reflect the way the child answered that question in the affirmative or the negative. By law, I have to document that I asked it and it was answered. I'm not allowed to ask mom to leave the room or dad to leave the room so that I can get an honest answer from this kid before I proceed with something.
This bill does not have anything to do with who is in the room
right.
when care is
Thank
provided.
You.
There is a motion on the bill.
Senator Rocky Adams. Senator Chambers Armstrong.
May I explain my no vote, Mr. Chair?
Yes, please.
I'm worried about the way this is going to impact kids' access to different types of medical treatment, particularly things like mental health. And so I really appreciate the intent, but I'm going to be a no vote today. Thank you.
Senator Berg. No. Senator Carroll.
Aye.
Senator Douglas.
Aye, but explain my vote.
Yes, please.
With all due respect, Mr. Chairman, it has been painful for me to sit here and listen to this debate.
I've noticed that.
To hear someone tell me, as a father of 3 adult children, say that we want to keep this information quiet because we, quote, don't want to make our children uncomfortable. Are you kidding me? My bottom line question is, who is the adult in the room? And again, I apologize, Mr. Chairman, but I sit here and I listen to this debate. And you know, as a parent, I'm responsible for insurance. I'm responsible for food. I'm responsible for paying for the doggone health care. And then someone tells me I may have a role in the decisions that my child makes? Really? Are you kidding me? HIPAA rules apply to minors. Look it up. Regardless of whether they are captured minors or whether they are emancipated minors. You know, folks, if a child doesn't want to talk to their parents, that's not a legislative issue. That is a parenting issue. You all elected us to be legislators, to make decisions about things that affect our Commonwealth and the people of our Commonwealth. You didn't elect us to be parents. Don't ask us to legislate the inability of a parent to communicate with their child. Most of this discussion is totally outside the bounds of what this bill is asking. Did anyone ever think about that? Well, let's think about those things. I apologize again, Mr. Chairman. Thank you very much.
Senator Elkins.
Explain my vote, Mr. Chairman.
Yes, please.
I vote aye. I absolutely agree with what Dr. Douglas said, but I'd carry that a step further. As legislators, it is not our responsibility to legislate secrets between parents and children. Nobody can be more informed, in my opinion, about a child's health care and well-being than the parent, the child, and the doctor. It needs to be a three-way conversation. With that, I vote aye.
Senator Funky Fromeyer. Aye. Senator Nemes.
I'd like to explain my vote.
Yes, please.
I vote aye, and I want to make it clear that when I hire a healthcare worker for myself or my children, I am hiring them to give me their expert advice in possibly treatment if I so choose. It is not their responsibility when I walk in the door for them to tell me what to do with myself or my child or what treatment they will provide. It is my decision, and it is a parent's decision, and it's my responsibility and right to know how to properly raise my child. And if I don't have that information, if it's held from me, I cannot do that. Thank you.
Senator Tishner.
Explain my vote, please.
Yes, please.
I'm going to vote aye. I think this is an interesting conversation. I'll say that. This is a parents' rights bill. This is a bill about having access to our child's health information so that we, as parents who are obligated to care for them, to raise them, to protect them, have knowledge of what's going on with them. And the idea that just because my child might be doing something wrong, I don't get to know about it. All the more reason I should get to know about it, because then I know and I can direct him in the way that he should go or she should go, because that's how I see fit. And it is not up.
Senator Wise.
Aye.
Chairman Meredith.
Aye. The vote is 8-2. House Bill 174 is amended by Committee Substitute 1. Passes with favorable expression. thank you for your testimony. Appreciate it.
Thank you, Mr. Chair. And there was a lot I wanted to say in response to the people who spoke, but I just want to say your committee members did a wonderful job saying the things that I wanted to say. So thank you all.
Thank you. Well, it was a hallmark moment for me as well as a former hospital CEO. First time in my life that I've had a doctor apologize to me, not just once but twice. So it's a very important moment for me. Just give me a moment to savor it. All right, I'm there. Next bill is House Bill 10. Representative and Chair of Health Services for the House, Kim Moser. Matter of fact, it's going to be the Moser show for the rest of this committee meeting with multiple bills to hear. So please, I think you've all been here before. Identify yourself for the record.
Yes, thank you
proceed.
so much.
I will note that we did hear this bill in the interim. There has been some changes to it, which will be reflected in the committee sub. So please proceed.
Okay, thank you. Sorry, I've got a stack of things here. I am Representative Kim Moser for the record. I represent the 64th District.
I'm Representative Nancy Tate, and I represent the 27th District.
My name is Kelly Talby. I'm the Director of Communications and Development for Kentucky Voices for Health. Sorry about my voice.
Glad to have you all here. There is a committee sub. I would appreciate if you'd speak briefly to the sub. Then we'll take action.
Sure. Yes. Thank you. There is a committee substitute. Sections 13 and 14 in the new committee substitute add perinatal palliative care. And Section 15 is an update to the staffing requirement for the Safe Haven baby boxes. Yes. Okay, thank you so much. House Bill 10 is also known as the Momnibus Bill. It's a bill that we have worked on through the interim in a bipartisan bicameral work group. We identified some problems in Kentucky with our maternal mortality rate. We are now aware. We started working with the Kentucky Perinatal Quality Collaborative and the Department of Public Health to really dig down on some of the data around our maternal mortality numbers. Unfortunately, Kentucky has the ranking as second in the nation in maternal deaths in the year following childbirth. And so for this reason, we really started looking at some of the most significant problems and how to solve them. And so there are several reasons we know for our high maternal mortality rate. The substance use issue in Kentucky is one of the most glaring examples of the devastation that we have all heard about in families and specifically in moms and babies. So our substance use problem is one of the most significant issues. As I said, 53% of moms who die in the year following childbirth die from their substance abuse problem. Other factors include Kentucky's high rate of obesity, diabetes, heart disease, and mental illness. These are all made more difficult during a pregnancy and can cause dangerous situations. Deaths due to any of these factors are usually preventable, and ways to prevent these deaths, are to identify and treat these diseases early in pregnancy, if not before, and this is why prenatal care is so critical. There were several problems that were uncovered during the interim long bipartisan bicameral working group, as I mentioned. Primarily legislators, primarily women legislators, not on purpose, but these were individuals who had filed legislation around maternal mortality. Some of the gaps and the barriers to providing needed care were identified, and the solutions are being offered here. In investigating the high maternal mortality numbers in Kentucky, we discovered that pregnancy is not considered a qualifying life event for insurance coverage. There is no structured mechanism to accessing mental health care quickly when we need to address it. Kentucky families, lack support during the postpartum period to keep mother or a primary care physician or an APRN, whoever the healthcare provider is, caring for the pregnant mother. If they identify a mental health need, they would be able to call a hotline and get immediate access to mental health treatment, and then a referral if necessary. This bill, I should mention that Kentucky has already applied for a grant to implement the Lifeline for Moms program, and I'm looking at Senator Tishner because she was part of the working group. Kentucky has already received a $750,000 grant to implement this program. It's a 5-year grant, which will be the DPH has applied and received this, and so they are already starting to implement this program. We want to codify this to make sure that moms and babies get the mental health, or moms get the mental health treatment that they need.
Motion on the bill.
Motion is a second. Any questions, discussion? If not, please call the roll.
Senator Rocky Adams. Senator Chambers Armstrong. Senator Berg. Senator Carroll.
Aye.
Senator Douglas.
Aye.
Senator Elkins.
Aye.
Senator Funky Fromeyer. Senator Nemes. Senator Tishner.
I can explain my vote, please.
Yes, please.
I will be voting yes, and I just wanted to thank you for your hard work. I know a lot went into this, and I'm looking at the votes from the House, 90-0. I mean, who could vote against this? But I just want to thank you for all the work that you've put into it.
Senator Wise. Chairman Meredith.
Aye. The vote is 9-0. House Bill 10 is amended, passes with favorable expression. Since unanimous, will we entertain a consent motion? Needs to be talked about. Duly noted. Alrighty. Congratulations on passing the bill.
Thank you.
Chairman Moser, if you
so
would,
much.
please continue with House Bill 115.
Absolutely. Thank you. Thank you all. Okay. Again, for the record, I am Representative Kim Mosier. I represent the 64th District, and I'd like to discuss another bill with you. This is House Bill 115. This is a recommendation from the Susan G. Komen group in discussing diagnostic mammograms for those individuals who have already received a screening mammogram which came back positive, and they just need a secondary
Motion on the bill.
Motion and a second. Senator Berg, you have a question? Or microphone, please.
Anyway, this is going to allow us to go ahead and do the diagnostic work that day, because right now, without prior authorization, which they refuse to give us, we have to bring them back. We can't go ahead and proceed that day because of the insurance companies. This won't help that, will it?
We did not address that issue. Yeah. I'm willing to look at that, though.
Yeah, it's a
like
big problem.
That.
It's a big problem.
I mean, if we can, you're so right. If we can just do it when the individual is in the office, give them an answer.
It's much better. Much better.
I think, though, maybe some of the problem is that they wouldn't get the results from the screening mammogram until days later. I don't know. We can talk, though. Okay, thank you.
Becky, can you please call the roll?
Senator Rocky Adams. Senator Chambers Armstrong. Senator Berg.
Explain my I vote?
Yes, please.
This is actually an important bill. Thank you very much.
Senator Carroll.
Aye.
Senator Douglas.
I would explain my vote.
Yes, please.
Representative Mosier, I want to thank you very much for bringing this. I'm on a couple of cancer screening boards, and you've heard me talk on and on about one of the biggest contributors to the cost of our healthcare system is actually patient noncompliance. I think this will greatly improve patient noncompliance, just patient compliance to the whole system. So I want to thank you very much.
Thank you.
Senator Elkins.
Aye.
Senator Funky Fromeyer. Senator Nemes. Senator Tishner. Senator Wise. Chairman Meredith.
Aye. The vote is 9-0. House Bill 115 passes with favorable expression. How about this one on consent? Motion consent. Second. All those in favor say aye. All right. Thank you.
Okay.
Chair
Wonderful.
Moser, you're on a roll. House
Yeah.
Bill 293, please.
Thank you. Thank you. I do have a guest. Thank you. I am Representative Kim Mosier, again for the record. I represent the 64th District, and I'll allow my guest to introduce himself.
My name is John McLean. I am the police chief for the city of Bellevue.
Thank you for being here.
You're welcome.
Okay, thank you again for allowing me the opportunity. I want to discuss House Bill 293. This is kratom regulations. We do have a committee substitute.
Motion on sub, is there a second? All those in favor say aye. Aye. Any opposition? All right, thank you.
The only thing that the committee substitute does is ensures that if the federal government regulates kratom in any way, that would supersede the state laws and the regulations that we're putting in place here. We would expect that the FDA or the DEA would take a look at this. They are starting to do that. I actually think that would be fabulous. It would be their job to do that, and we wouldn't have to be here right now. But because we don't have any federal regulations at all, the bill would regulate the sale of kratom and is a Consumer Protection Act. It does not take a position on whether or not there are positive or negative effects necessarily about kratom, but we do want to keep it out of the hands of anyone under 21, and that's really what this does. It also requires labeling so that consumers know what they're purchasing, and really that is what it does. It defines kratom in statute and just makes sure that there are fines for those who are selling this illegally.
Motion on the bill.
Second. We do have somebody who's signed up to speak in favor of this bill. We can allow them to come to the table. We'll allow them to have a
if you
word.
say anything.
Before you folks leave, Senator Franco-Fromeyer does have a question. So please, Senator.
I was approached by one of my family members who is very active in the Erlanger school system, but recognizing that I've got one of my top dogs in Bellevue here, I just wanted if you would share what is the issue with kratom. Until this session, I hadn't heard about it, but I've been lobbied by my own family. And
I can't testify for an issue on kratom as far as legal. I can't testify of any issues on kratom as far as a legal sense, whether or not we've arrested anybody for public intoxication on it or had any overdoses. What I can say is when we have a kratom store in the city of Bellevue, and as far as I know, that was the first store that only sold kratom in the state. That's based off their website and some research I did when they first opened, because we didn't know anything about it. So you have officers would come and ask me, they're like, well, what's kratom? And we look it up, and you basically find out from what the internet says is that its nickname was kind of the legal opium or legal heroin because of the effects that it's said to have, which isn't proven scientifically through any extensive research. So a problem on my end that we see with that is just safety concerns. And, as police officers, we don't just, charge people with crimes or take people to jail. We look out for their safety, whether it's safety from others, safety from products, anything like that. So it's always a bad thing when you got people that are taking a product with no warning labels. They don't know where it is or where it comes from or anything like that.
thank you, Chief McLean. And I know that is who you are. And I know I've seen you active in our community. And thank you for your good work.
Thank you, Senator Fromeyer.
Glad to see you here.
If I could just add to that just briefly, so that you're clear on what this is, because it sounds like I didn't do a great job of explaining that this is a natural herb. It's actually from Asia, I think, Indonesia. It's Mitragina speciosa is the scientific term. Some people use it for anxiety or pain or PTSD, but this is all really anecdotal because we don't have a lot of research, as Chief McLean said. It does cause, apparently in higher doses, euphoric effects, very similar to heroin, and that's where it's abused. And so this is really the issue. It has addictive potential, and we just want to make sure that if somebody, an adult, is using it for pain and they're finding relief, that's fine. But we want to make sure that kids don't start using it. So that's really the issue.
Thank you. As I noted, we do have a Mr. Jonathan Miller who is signed up to speak in favor of the bill. Are you here? Would you like to testify? I see no one approaching, so there is a motion on the bill. And a second. All in favor, vote aye. Excuse me. Didn't see you way over there in the corner.
I know. I'm sorry. I normally
please.
sit a little closer. I just had a very quick question for the sponsor, and I'm still learning about these things myself. Someone had asked me if this bill is intended to have any impact on 7-OH, which I gather is sort of a related product. And I think what I hear you saying is this is the Kratom bill, not the 7-OH bill, and shouldn't have any impact on the other one. Did I hear that correctly?
Well, that is correct, but 7-OH is listed as one of the ingredients in the bill, and so there's someone who has asked me about this as well. I'm willing to look at that. I think that the provision that we're putting in the committee sub that says if the federal government weighs in some way, that that would supersede what we're doing here. I don't know enough about the ingredients to know whether or not this is, it's part of the ingredient list. When you go to Section 3 of the bill, it's actually Section Section E, sub 3D, where it says contains any synthetic alkaloids, including synthetic mitragine, synthetic 7-hydroxymitragine, and that's the 7, I don't know what you called it. But so this is one of a long list of products, I guess, that are considered kratom. So I don't know if, I know that the jury's kind of out. The FDA may or may not have weighed in on whether or not that's a safe product. I'll have to look into that. I mean, I think I'm open to a floor amendment if it'll clarify.
Thank you. It sounds like I have more information to learn as well, but I appreciate your response.
Yeah.
Thank you.
Okay, sure.
Comments, questions? There being none, we do have a motion, a second on the bill. Becky, please call the roll.
Senator Rocky Adams. Senator Chambers Armstrong. Senator Byrd. Senator Carroll.
Explain my aye vote, Mr. Chairman.
Yes, please. Thank you.
Rather be voting to make it illegal, but short of that, regulating is better than nothing. Thank you for the bill. Thank you, Mr. Chairman.
Senator Douglas.
I say aye. I'd like to explain my vote as well. I agree with, I want to echo what Senator Carroll is saying. I think he makes a really, really good point. But I want to thank you, Representative Mosier, for bringing this.
Thank you.
Senator Elkins. Aye. Senator Funky Fromeyer. Aye. Senator Nemes. Senator Tishner. Aye. Senator Wise. Aye. Chairman Meredith.
Aye. Motion passes unanimously, and we'll advance to favorable expression. Is there consent on this one? Motion for consent. Thank you. Is there a second? Second. All those in favor say aye. Aye. Any opposition by like sign? There being none, bill is on consent. Thank you. Moving on, House Bill 459.
Yes, sir. I have a few guests. Thank you. Thanks. Okay, again, for the record, I am Kim Mosier, State Representative for the 64th District, and I have some guests with me.
Yes, good evening, Mr. Chair, members of the committee. I'm Mackenzie Wallace. I'm the Director of Public Policy for the Alzheimer's Association.
Kelly Jenkins, the Kentucky Board of Nursing Executive Director.
It always concerns me when a simple little bill has three people that have to present, so I would beg of you, give me the delivery, not the labor. Thank you.
Well, we are just covering our bases. This is actually a very simple bill. We do have a committee substitute.
Yes, there's a motion on the sub. Motion. Second. Second. All in favor say aye. Aye. Any opposition? There being none, thank you. Please proceed.
Okay, thank you. the committee sub simply adds a 1 hour, one-time continuing medical education requirement for nurses at all levels of licensure. We were going to try to work in physician assistants, but that didn't work out. So right now we are, this only applies to nurses. I can run through the bill quickly. What this does is updates the Kentucky Board of Nursing membership, board membership, to include more clinicians as opposed to all academicians, which is, I don't know if I'm overstating that, but it's primarily that now. It lays out the nomination process. It includes advanced practice registered nurses and certified registered nurse anesthetist on the board to bring them in to have a voice and be more collaborative. It allows for an APRN provisional license for APRNs who are awaiting the results of their national licensure exam, and they would work under supervision. That's it. I don't know if you have anything that you'd like to add. We have the support of the Kentucky Board
Motion
of
on the
Nursing.
bill. Is there a second? Second by Senator Carroll. All those in favor vote aye. All opposed vote no. Becky, please call the roll.
Senator Rocky Adams. Senator Chambers Armstrong. Senator Berg.
Aye, and again, thank you. Thank you. Some really good legislation being brought forth today. Thank you.
Senator Carroll.
Aye.
Senator Douglas.
Aye.
Senator Elkins.
Aye.
Senator Funky Fromeyer.
Explain my aye vote.
Yes, please.
I didn't get to speak up earlier, but House Bill 10, but this bill as well. So much important work that you're doing. I don't know how you get it all done, but I know you surround yourself with excellent people. And
It just feels like a lot more right now because I get to do it all at once.
but it is so important. Thank you
so much. I appreciate it.
Senator Nemes. Senator Tishner. Senator Wise. Chairman Meredith.
Aye. Again, the vote is 9-0, unanimous. So bill passed with favorable expression. There's a motion for consent and a second. All those in favor say aye.
Aye.
All right. Motion carries. It is on consent. Last bill we have for consideration is House Bill 505. Before you get into that, Chairman Moser, a couple of the Senate members who had thought we would want to do House Bill 10 on the floor, I think have decided that they would prefer it be on consent, so I'll entertain a motion for consent. Motion and a second for consent. All those in favor say aye. Aye. Any opposition? There being none, House Bill 10 is on consent as well. Thank you. Last bill for consideration is House Bill 505. Please proceed.
Okay, thank you so much. Again, Kim Mosier, State Representative for the 64th District. And today we are here to discuss House Bill 505. We do have a committee substitute.
Is there a motion on the sub? Motion. Is there a second? Second. All those in favor say aye. Aye. Any opposition by like sign? There being none, approved.
Okay, all the committee substitute does is requires that non-registered peer support specialist be registered with the Kentucky Board of Alcohol and Drug Counselors by January 1st, 2026. There's another date, I believe. But we, and that, I think this is the gist of it. So, okay. All right. What House Bill 505 does, and we can elaborate do you have any other news on the committee sub?
Oh, yeah, this is Jessica Burke. I'm the Chief Legal Officer for Addiction Recovery Care. Basically, the sub allows for a ramp-up time, so any new peer support specialists would have to meet the requirements of the original bill immediately. Existing peer support specialists would have until January 1st, 2026 to give them time to meet those requirements.
Okay. You see why I have her next to me. Would you like to introduce yourself since we're sitting here?
Yeah, I'm Aaron Smallwood, Clinical Services Director for StepWorks Recovery Centers in Kentucky.
Welcome.
Thank you. All right. So House Bill 505 is really deals with peer support specialists. We know that they are an important category of drug and alcohol counselor who have lived experience, and they're able to and very valuable to this population of people who are seeking treatment for their substance use disorder. What this bill does is strengthens the peer support specialist program by adding eligibility standards and criteria. It moves peer support specialists to under the Alcohol and Drug Counselor Board. Right now there's no oversight, and we definitely need oversight of this category of
Motion on the bill.
worker.
Motion second on the bill. Any questions, comments? There being none, Becky, please call the roll.
Senator Rocky Adams, Senator Chambers Armstrong, Senator Berg,
I explain my yes vote.
Please.
Desperately need oversight. Desperately need oversight. This is an excellent bill. Thank you.
Senator Carroll,
Aye.
Senator Douglas,
Aye.
Senator Elkins, Senator Funky Fromeyer, Senator Nemes, Senator Tishner, Senator Wise, Chairman Meredith.
Aye. Again, the vote is 9-0. House Bill 505 is amended, passed in favor of expression. There is a motion for consent. In a second, all those in favor vote aye. Aye. All opposed.
Okay.
Congratulations.
Thank you so much. This is wonderful. Yeah, I really appreciate all of your help.
Committee members, before you leave, we do have some other regulations that were presented to you. I'll entertain any questions, comments. If not, we'll consider them approved. Just give me a nod if you're okay with that. That being the case, thank you. We stand adjourned.